Hey everybody, I am here with my friend Amanda today. I'm so excited for you to meet her. She is a current NP student and CCU charge nurse. She is balancing all the roles with ease from the outwards perspective. She looks like she's doing it with no problems. So I thought she would be the ideal person to talk to about what it's like being in the throes of things. I know that many of you are in this situation, so we're going to talk about all the things that she does, how she chose her school, her background, all these kind of things. I think you'll find a lot of value from this video. If we haven't met yet, my name is Bree. I'm an RN and NP mentor, interview strategist, and content creator. Welcome to the channel. Okay, so first of all, tell the viewers about your background as an RN.
So I started my career in May of 2019. That's when I graduated nursing school. So I was lucky enough in my senior year to get a practicum in CCU. So at my hospital, when you first match into your residency, you are matched to a track. So my track was critical care. When I started in critical care, you rotate through all the different ICUs that offers. So whether it's surgical trauma, the cardiac ICU, medical ICU, whatever they had to offer at the time. So when I was rotating through, I always had, in my background that I had been in CCU and I loved it. And so that was kind of where I wanted to go, but I was open to see what was offered. And then when I matched on my, matching day, I was matched to CCU, which I absolutely love. I love our cardiac patients, and CCU is essentially a medical ICU with a focus on cardiac.
That's right.
And
it's kind of an overflow. You get a lot of different things there.
It is a broad experience, and I absolutely love that we see so many different patients.
Mm-hmm.
It's nice that it's not just one patient.
Mm-hmm.
So that's been enjoyable. And then of course, I graduated in May 2019, got off my orientation
right before
COVID. So COVID really took a toll on me, in I think everybody's mental health.
Mm-hmm.
And I think framing how you look at what that was for what it was, we can all say like it was challenging, but to grow from it, I think was
sure.
probably the best thing that happened for me.
Sure.
Is I didn't just stay in this one little element of I'm going to be a cardiac expert and that's all I want to do. It really pushed me outside of those comfort zones to realize that there is more to nursing, and there are more patients, and all patients really deserve the best care, and to have a nurse who is well-rounded.
Sure. So how did you, or when did you decide to go back to school?
I always knew I was going to go back to school. So initially, and things kind of changed and evolved. Initially, my thought process was I am going to graduate with my BSN. I'm immediately going to go into my MSN. When I got to the bedside, that changed very quickly. And I think it's for the best, because I think a lot of people, when they are in, their BSN and they're getting that undergrad degree, they all think like, I'm going to become a nurse practitioner. I'm just going to skip the bedside. I'm going to become a nurse practitioner, because why would I want to go and be just a BSN? Yeah. It is the experience that you gain at the bedside is so valuable. And I think that it is, I mean, in my clinicals now, I know that everything that I have done at bedside, my skill sets have been building on this.
Sure.
So I can assess a patient, I can talk to the providers. I have an idea of what, they're going to say. And I can't imagine just not having that experience.
Yeah. For the vast majority of people, the way our programs are designed is to build upon themselves. So the reason we're able to, expedite this medical education basically into 2 years or 3 years is that the expectation is there that you already understand the basics. And so then when you're going to learn pathophys, medical pathophys, it builds upon what you know as a nurse already.
Right.
So yeah, I think the same thing, especially for our acute care friends with no experience going in, having to learn ventilators, with not even having any practical use with them. I find it very overwhelming for people who want to do that kind of thing. So I'm glad that you kind of supported that in real life. It's hard. It's harder than you think it's going to be with no experience.
It is. And our patients deserve our best. And I have so many of our professors have said the same thing is, always go into this not thinking what can be the best for yourself, but think how you're going to best serve your patients.
Sure. So did you, making your decision to go back to school, did you know like what your end goal is, or are you just going back and kind of figuring out as you go along?
I was thinking about this morning before I got here. I have always thought, like, what is my big goal? My big goal has always been, I want to be successful. And what does that look like to me? Mm-hmm. So if you'd asked me this 10 years ago, what was successful to me? Well, I was no longer working at, an office just taking calls. I was working in the hospital as a tech, and I thought, I'm successful now. But
Yeah.
what's my next success?
Sure.
So then I was like, I want to be a nurse.
Yeah.
And, I graduated and I was a nurse. And, 5 years ago, me would have been very happy and like, she's successful now.
Mm-hmm.
And then I've always just said, what can I continue to do to be more successful
Just
for
a
myself?
moving target.
Right.
Constantly moving target.
And I knew I wanted to be a nurse practitioner because working in an ICU, I have worked alongside many nurse practitioners who, they're my role models. They're people that are doing the things that I want to do. So I love bedside. I love taking care of patients. In my charge role, I may not be, at bedside all the time, but I'm constantly in those rooms helping, to assess those patients, help the bedside nurse. And I'm essentially like a liaison between our providers and our nurses to, kind of assist as much as I can. And I love speaking to them, watching their brain work and work through something. So I know we run several rapid calls together. And I love when you go into a room, you're looking at this patient, I've assessed them and I've told you what my assessment is. And I can see you thinking through it and coming up with a diagnosis. What is going to be my plan? How can I serve this patient? And it inspired me. So
Yeah.
I want to do that. I want to be somebody when I show up, they know that I'm going to be able to come up with a plan that's going to help my patients. So it's furthering my learning and becoming more to help my patients has been kind of what I wanted to do.
Yeah. So it sounds like you really want to do inpatient work.
Right. So I applied to several different schools, and I know a lot of people do this. And at the time, I didn't know what I wanted to do. I didn't understand, like, what's the difference between FNP versus ACNP? How are the roles different? Can I work in a hospital as an FNP? Can I work in a clinic as an ACNP? And really what it boiled down to is I was accepted into both programs. One program was supposed to start in the summer, and I was waiting to hear back from the other program, which is the ACNP program that I'm in. And I was speaking to one of my colleagues who is dual certified. And essentially what she said is, okay, take away all of your goal of success. I understand that, but take that all away and say what you want your family life to look like. And I think highly motivated people sometimes forget to look at that side of their life.
Absolutely, yes.
And I had to stop and think, like, I do love my family and I do want to be with them, but sometimes I think I get very goal oriented and I kind of put them on the back burner, and I don't want to do that forever. So that got me to thinking, and she's like, look, if you're going to be an FNP, you're likely going to be in an office setting. That's 4 or 5 days a week. You're seeing patients, and then when you go home, you still have to kind of think about that patient that you're following with long term, what they're going to do, how you're going to further their plan long term. And then she's like, and think about ACNP. She's like, it's not any less difficult. She's like, but you work 3 days a week most of the time. That's not, and again, that's not the same for every ACNP, but 3 days a week, 12-hour shifts, which you're already used to. And you'll be inpatient, or you can work in a specialized clinic and get to see those patients for a shorter amount of time, maybe, but you work through big problems. And I like big problems. So I was like, I love that. I think that's what I want to do. And she's right. I want to be able, I know that this schedule works for me and my family. I want to be able to be home with them more. I've done the 9 to 5 before, and it doesn't work for my lifestyle. It may work for other people's, but it didn't work for my lifestyle. So ACNP was a clear choice for me. So when I heard back, I was like, absolutely, that's what I'm going to go with.
And in Georgia, it's not this way across the country. I talked to NPs across the country. In Georgia, where we're at, to be inpatient, you have to be acute care. It will eventually be that way nationwide based on the consensus model. But in a lot of places, particularly critical access hospitals and stuff, there are plenty of FNPs that are either grandfathered in or even hired in to work in the hospital. But yeah, you're right. There are, I don't know really any outpatient centers where you're doing 12. Some places will do 10s, particularly surgical groups. So you can get some variation there. But yeah, in general, your work-life balance is going to be a little different.
Right.
That in-basket never goes away. That charting never goes away, which isn't to say that you're not working a lot or busy when you're doing 12s. Many people work 7/12s, which to me is just abhorrent. I can't imagine that having any kind of work-life balance, but plenty of people like that. So the great option is there. The great thing is that there are a lot of options for us. So that is to me the beauty of nursing. I went to school in I was applying to school in 2015. So I think I asked maybe 3 physicians to write references for me. And one of them said, "Are you sure you want to do that? The market's saturated." And that was the first time I'd ever heard anybody say that to me. Now that is everywhere. Everywhere you talk to someone that you mention out loud, you want to go to NP school. Are you sure you want to do that? There are no jobs.
Yes.
Did you hear this?
Oh, absolutely. When I said I was going to MP school, I just like no one really batted an eye. They're like, "Oh,
Yeah, another
you
one.
too?"
Another one.
Yeah. So for me, I'd heard that going through my BSN. My professors were all like, "Don't even try to apply. I mean, there's not going to be a job for you when you're done," and no one wants to hear that. But I do think that there are. I mean, clearly, there's plenty of NPs out there. But I look around and I remember COVID and I remember when we didn't have enough providers.
Sure.
And I think that what you have to look at is, okay, nursing is having a shortage right now. There's the mental health crisis, people leaving because it's hard.
Mhm.
I think the same thing is happening across the NP board. So I did hear that a lot, that the market is saturated. And I think that that can turn a lot of people off. But I also think that the market being saturated will eliminate, not eliminate, eliminate's a terrible word, deter people who are not in it for the right reasons. I think that if you truly want to do this and you have the heart for it and you are one, good at what you do and good at caring for your patients, people will notice that and they will want to hire you. So I don't think saying the market is saturated is always the best thing to say to somebody who has this goal, but I think saying, "Hey, it's difficult to get a job right now," will encourage them to really perform their best.
I think that's great. I think that's a great way to look at it. Okay, let's talk about school, the stuff y'all want to know about. Where did you choose to go to school?
So I am at the University of Alabama at Birmingham. I love my school. I have absolutely nothing bad to say about my school. I applied to several. I applied to University of South Alabama. I got into the University of North Georgia for their FMP program. I looked at Augusta and I looked at Emory. Choosing a school for me, I didn't know what I wanted. So it was kind of easy to apply to a bunch of different ones and look at what their requirements were. And I remember watching your video on Nikki and she was like, "I'm gonna be honest with you, I just went with one that had the least amount of hoops to jump through." And in a way, I kind of did the same thing.
Yeah.
I looked at Emory and it was a hard no for me just because of the price. It was out of my price range. I'm working full time. I don't want to take a bunch of student loans. And for me, that just wasn't going to work for me. So price out, done.
Yeah.
I looked at Augusta and I think you have to go down there several times. And I was like, that's out. I don't want to travel. And then looking at UAB and the University of South Alabama, both were comparable in price. So I was like, oh, check that off. For UAB, it's a distance learning. So I could be home, still work full time and learn at a distance. And they had on-site incentives. So you have to go in and physically be there to work through your skills. And I was like, okay, if I had to drive down there a few times during the program, that'll be fine. So then looking at the application process, it was pretty easy. I think I had to write an essay, fill out the application. I didn't have to do an interview for UAB.
Okay.
And I think that's the only like big stuff I had to do.
Yeah.
The waiting was what killed me though.
Yeah.
So when I got into UAB, I was very excited and it has been an incredible journey. Really,
Yeah.
they are so organized and this isn't, an ad for UAB or anything. I feel like they really have it figured out. The first year is all didactic coursework. So you are working on theories and, the anatomy, physiology. You're looking at, the pharmacology of everything and it builds on each other. Mm-hmm. So your first semester is going to be very basic. The second semester is going to be more difficult. And then the more you move on, it gets more difficult, but it all builds on itself. So it doesn't seem hard, but if I had started in my third semester, I'd be like, this is way too much. Yeah. I couldn't do this. And then that third semester, you actually go onto campus and you spend, I think it was like 2 or 3 days where you're working through skills. So intubation, LP lines, all of the fun things that I think about when I wanted to be a nurse practitioner. I don't remember what they called it, but the way that they taught it was they sent you what you were going to be doing. You could watch all these videos, you could read about it, look at it. And they expected when you got there, you had a basic knowledge of what the skill was.
Yeah.
You go in, they have stations set up and you're in a group of 3 or 4 people. At that station, you have everything that you need. Everybody gets hands-on. Like nobody is you're not standing around watching one person. You are all hands-on, which I feel like a lot of people have to, especially nurses, we're all hands-on. When we learn, we have to touch it. So you start with the skill, you sit there, you play around with it, you have a provider in front of you who is doing the skill with you. So you do it as the provider does it. And you do that several times.
Mm-hmm.
Then you go around and you watch one person do it, and you all talk about what were their learning opportunities, what they did really well, and if you thought that it was performed correctly. Which that was kind of nerve-wracking.
I don't know you, I just met you, but I'm going to judge you on what you just did.
But everybody had to get judged, so we all knew, like, be a little soft on them.
That would be horrible.
It sounds horrible, but you've already done it 20 times, like, by yourself. So it really, by that point in time, we're all looking at it and we're learning together. And so, like, if you make a little mistake, we're like, oh yeah, do this, or oh yeah, do that. And then you talk about it, and then everybody goes back to their station. They practice by themselves or with a partner, however you want to do it, a few more times, and then you do it as your checkoff.
Yeah.
I have never been more confident in my life than doing it in that setting.
Are you asynchronous online, or is it like you have to show up at a certain time for classes?
We are completely asynchronous.
Okay.
So I do not have to show up at a certain time. Now, that being said, there are one-offs. So every now and then we will have a certain lecture that has to be taught live, but they also know that their students work in the real world. So they are not, like, they expect you to do it. They're not going to hold your hand and force you to do it, but they expect you to do it. And if you don't, I don't know what happens if you don't, because I always do it, but I assume that you wouldn't be successful. But they know that their students want to be successful, or they wouldn't be there. So for me, the asynchronous works great because I do work full time, which is not always recommended. It's a little hard, but I can go to work my 3 days, and then on my off days, I just have to push myself to really engage in what we're learning and do my best to understand it so that I can, be successful on tests, but also I have a professor there who's so wonderful. He always says, like, don't do this and pass a test.
Yeah.
Do it for your patient. They deserve the best out of you. If you don't understand what's going on, what good does it do you? You want to just come pass a test, or do you want to be successful in the real world? So,
calling all of you novice NPs who are getting ready to do your first rotation in the ICU and or your first job in the ICU. This commercial is for you. This is the one where I tell you about how I stopped staying late at work. It took me 4 months to get there. And what turned the tides for me was once I learned the power of writing dot phrases. Create a robust library of dot phrases in your EMR so that you can very quickly pull bodies of text into your note and just edit it so that it's specific for your patient. You're going to get very, very, very efficient at note writing when you do this. The other benefit of dot phrases is that you have access to information for things that you don't see very commonly. So reminders of things you need to check, things that are very complicated like liver failure, all the different components of that, labs you need to check, diagnostics you need to do, treatments, what to talk to the family about, and you're like, oh yeah, I got it, oh yeah, I got it. So it's good reminders. It just makes you so much more efficient. And I have taken 11 of the most common of those diagnoses and put them into a book. So in this book, you're going to have these diagnoses with the template that you can copy and paste and put into your EMR. I've done all the work for you. You can edit it how you like it. And then there's a couple of pages of behind the scenes for each diagnosis. So pneumonia is an example in here. We're going to talk about CAP versus HCAP, the antibiotics that you choose and why you do what you do. So it's a little bit of a behind the scenes on what I teach my students when they do a rotation in the ICU. So if this would be a benefit to you, I would greatly appreciate if you would check out my website at briemp.com. There's an e-version and a hard copy I would be happy to mail to you. And if I haven't said it before, thank you so very much for supporting this channel and all the endeavors that I have. My whole goal in life is to help make things easier for you and be the mentor that I wished I had had. Thanks again.
So speaking about balancing roles, because you mentioned you're working full time, holy cow.
I know.
I'm so impressed with this. How long is your program? Is it 3 years?
It is 2.
2 years. Okay. And you're getting your doctorate or master's?
Master's.
Okay. And so you're full time in your program. So you're taking how many classes?
So they call it part-time.
Okay.
So but they also offer subspecialties. So I've been taking 3 classes from the very beginning.
Okay.
So I did a subspecialty in palliative care, which I finished in the first year. So it was 3 classes all the way through the first year. And then the last year, it's 2 classes, but one of them is a didactic coursework. And then the second one is your practicum,
Okay.
which has some coursework with it, but it's mostly your practicum.
Yeah, sure.
So 3 semesters are practicum, 180 hours in your fall semester, 180 hours in your spring semester, and then 250 that last summer semester. I also mentally, the way that I compartmentalize this is it's a short time.
Right.
It's not forever.
Yeah, in school. What have you given up in your life to do this?
So, like I said, I have always been super busy. So all through COVID, I worked 5 and 6 days a week. I mean, I was working 60 hours a week. So this isn't something that's necessarily new to me to be at the hospital this much. I'm just not picking up overtime.
Okay.
And I was full-time through my BSN program as well, which they were not happy with. My school was not happy with that. But I've always done this. Like, it's not something that's new to me. So I think that's what made it easier for me.
I see.
If you're going into this program and you didn't work full-time in your BSN, you're not used to how to manage your time effectively. I don't know that you would be as successful in it. But because I did this, I've done this for so long, I feel like I've kind of trained my body to be almost immune to being at the hospital for so long. But I mean, I have made sacrifices where I needed to. My husband is wonderful. He's very supportive of me. We've been together for, I think we're going on 9 years now. So he knows that obviously I love him and I don't have to be with him 24/7. But we got married last year and he's just been such a champion for me. He wants me to be successful.
Yeah.
And so he's like, if I don't see you but 1 day a week, that's fine. We're going to be together every night. So I don't have to see you through the day to know that, that you love me and care about me. So he's kind of taken a role, not necessarily on the back burner, but realizing that we're not going to spend every day together. And then my friends, they're all nurses or nurse practitioners. And we've all worked together and they know what struggles I'm going through. So I don't have as much going on in that sense. And I think having, friends and family that understand what I'm going through and support me has been so valuable. But it also allows me to spend more time doing these things like work and school.
Yeah. Let's talk about studying in specific. So how much do you study? Do you have any study tips for people?
I hate reading. I hate reading a textbook. It doesn't interest me. I'm going to drool all over it because I'm going to fall asleep.
Yeah.
So reading has never been easy for me. Now, if I have to read something, I just get all the colors of highlighters that I can because it's a distraction for me. I know when I'm highlighting it that it's helpful. But for me, I love watching YouTube.
Yeah.
So I follow someone called Medicosis Perfectionalis. Have you heard of that one?
No, that's
He's fabulous and he is wonderful. So if I'm studying a topic, I just Google search that topic, pull up whatever YouTube videos are on it, and I like to hear it. And then what I do is I take notes. So I write more than I probably should. I do a lot of, I have to hear it. I want to physically write it. Every now and then I will refer back to the textbook. It's not my main thing. So I know a lot of people that are like that. But yeah, YouTube videos for sure. Find somebody that you can watch consistently because I have found that some people, I will hop around. Like if I don't understand a topic and he does a video on it and I'm still like, oh, I'm not really sure about it. There's always more. And those have been super valuable for my learning. So yeah, YouTube videos, watch it, write it, listen back to it because you're going to hear something you didn't hear the first time, especially if you are a writer like me. While I'm writing something down, I may miss something important. So I always go back and listen to it. But listening to it, he's a doctor as well. So listening to it from their point of view and not necessarily a nurse's point of view, because as nurses, we carry out orders and we assess and we report them. As a provider, we listen to what the assessment is. We do our own assessment, and then we have to figure out what are the orders that we're going to put in that nurse has been carrying out. So it's the role change for me has been a little difficult in realizing that, I'm not responsible for necessarily carrying out those orders. I don't need to write them and then carry them out. I write them and then see how they do. So that's been difficult, but I like listening to doctors talk more now, which I did not realize when I first started studying as an NP. I was watching a lot more nursing videos and I was doing fine on my test, but I wasn't grasping the concepts as well as opposed to listening to a physician talk about it. And the thought process is very different. So that's another recommendation. So watch the YouTube videos and look at it from a different perspective. Don't just look at it from a nurse's perspective. You have to look at it from a medical perspective. Something that is so valuable is you have to learn how to organize yourself. I consider myself an organized person for the most part, but going into this program and realizing that you're doing pharmacology, let's break it down. So you have cardiac pharmacology, and then you're doing your cardiac pathophysiology, and then you're doing your assessment and diagnostic reasoning. When I started clinical, and my first practicum was in cardiology. So when I went to go look at all my notes, I was like, I have all of these notes that I need now. I need to pull them together so that I have all parts of it so it makes sense to me. So when I went back to restudy for that practicum, I was pulling notes from all these different things and realizing if I had organized this just a little bit better, it would have made my life so much easier. I also, my calendar is color coded for days I have off, days I'm in clinical, and days that I work. And so I can do a quick look and say pink days are the days I have off, and then green days are the days that I'm going to be in clinical. And it just helps me in a mindset that says, okay, I have this big block where I have all of this going on, and look, I have a test coming up, so that I can break down my learning. Because if you wait too long, because it's easy, you're doing so much, it's easy to get behind on things. So I would get home every night and I'd be like, okay, I don't want to do this, but I'm going to study for 20 minutes because I know that on these 2 days I have off before this test, I can't fit all this in. So take the time every night to kind of pull together, what do I need to do, and break this apart so that I'm prepared for my testing.
Sure. One day at a time. It just literally, when those tasks get overwhelming, and they will, you just do one thing at a time and you start checking them off.
Yes. What can I do to be successful on this test so that I'm prepared to move on?
Right, exactly. I want to circle back for just a minute because you mentioned it and I didn't really grasp onto it at the time, but does your school help you with clinical placements?
So no, okay, this is difficult. So if you live in Alabama and you live close enough to UAB, they do have a program for students that work at UAB or are planning to do clinicals there, where they do assist you with that. They have, and it sounds wonderful. I forget what they call it, but I mean, you rotate through a ton of different things, and I wish that they had that elsewhere, because that would be amazing. But they set up their clinicals there. If you are not planning to do your clinicals at UAB and you're going to go elsewhere, like I am, you have to set up your own. For me, setting up my clinicals was not hard. And I know that for some people, it can be very daunting to ask somebody, like, do you mind taking on this extra responsibility and teaching me? Because we all know as nurses, we've had to take nursing students. And some people are not cut out for that. And some people don't want to do it. And I think that if you are not someone who likes to teach, that, you know, for the people that don't like to teach other people, I think that they look at themselves as a burden. Like, I don't want to become the burden that I feel like other students are to me. For me, I love to teach. So it was always, I sought those opportunities out. So I enjoyed asking people, like, hey, do you mind if I respect you and I think that you're wonderful? Do you mind if I shadow you, or, you know, will you precept me? I also happen to be lucky enough to work alongside several wonderful nurse practitioners. So my program is, you know, you have the 2 semesters with 180 hours and then that 250 hours. They don't care how many preceptors you have during that. You just have to spend 180 hours with a nurse practitioner. The rest of them can be scheduled with a provider, whether you can't do a PA, but you can do an MD. So this was where I wish I'd known this last semester. So working full time, I don't have all these extra hours. If I'm working 3 days 1 week, those 3 days, I obviously cannot do clinical. So that left 4 days in the week that I could do clinical, and it was starting to get a little difficult for me to schedule around my preceptor. So this semester I'm with an MD. So he does that 7 on,
7 off, which makes
7
it
on,
much
7 off.
easier, I would think.
It does, and he also does clinical. So he will work 5 days a week, 5 days a week, and then 7 days a week. So this semester it's been so much easier to schedule everything, knowing that I can work around his days. And I know what to expect because it's cyclic. Whereas hers were, I might work a Thursday, Friday, Saturday, and you know, it was a little more difficult. So I think keeping in mind, picking my preceptor was easy because I knew them, and I was confident going up and talking to them. I'm friends with most of them, so it was easy for me. I think if you are that person who doesn't like to ask for help, it might be a little bit more difficult, but also understand that a lot of people do like to teach. And it can't hurt. Shoot off an
Yeah.
email if you don't
Yeah.
want to talk to them.
Yeah.
Our work has a director for this where they will place you with somebody if you don't know somebody. So I didn't know about this. So if you don't feel confident asking somebody, you can always ask your work if they do something like that. A lot of times they do have a director that will of clinical placement who will place you with somebody.
Oh, that's a good idea.
Yeah.
I did not know that.
I didn't either. And I don't think a lot of people realize that many hospitals have this resource
Interesting.
where you can speak to HR and they have preceptors that are kind of in their little preceptor pool and they'll just place you with them.
Oh, that's cool. That's
Yeah.
a great little perk.
Yeah.
Yeah.
It's very interesting. I wish I'm glad that I already have my preceptors, but knowing that I had that backup
Sure.
is nice.
Sure.
So yeah, picking your preceptors, scheduling with your preceptors. I started looking for my preceptors my first semester.
Mhm.
I was not playing around. I had heard how bad this was going to be, so I was like, I'm going to do this
Yeah.
early. So I picked them out and had them lined up immediately.
Yeah.
And then I always had backups too.
Yeah.
So knowing my first semester was kind of my first practicum was kind of a trial run, and I saw some things that I could have done better or things that would have made my life a little bit easier. So this semester I had 2 backups, and then luckily I'm with an MD, so scheduling wasn't an issue. But then my next semester, I was like, I'm with another nurse practitioner. They only work 3 days a week. I'm going to ensure that I have a couple of backups so that if for something happens and I can't be with her one week, I have somebody that I can be with. So don't limit yourself because scheduling gets tight. And like someone who takes a vacation and you've planned on working with them those hours and then you have to figure out when you're going to make them up, can be very difficult. So yeah, that's pro tip. Have a backup plan.
Good. So has anything have you had any magical moments during clinicals that or things that you were unexpected? Anything that you want to share from clinicals?
Oh my goodness. So clinicals are so much different as a nurse practitioner than they are as a student. And I think mine wasn't necessarily magical. I kind of had a little breakdown because I was like, I am not prepared for this. And I was like, am I doing the right thing? Because you get there and they're asking you questions and you're like, I know this, but I don't know this. And so I was sitting there charting one day and my preceptor, I love her so much. She was wonderful. She asked me a question and then she was reading over my note because she had to submit it. And she's like, what are you doing? And I was like, what do you mean? She's like, why are you reinventing the wheel? Like, what is all of this? And I'm like, I know. And I was so proud. I've been on Up to Date and I'm like searching it. I'm like, oh, put that in there. And I had so many big words. I was like, something blah, 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 cardiomyopathy. And she's like, no. Just erased it all. And I was like, no. I was like, why is she doing this to me? And then we rewrote it together. And then I realized oh, okay. I'm overcomplicating things. I'm making this so complicated. So just take the time to realize, have grace on yourself because when you get into those clinicals, you're going to be smacked in the face with all these new things that you are like, oh, wow, I thought I was prepared and I am not prepared. So it wasn't necessarily a glorious thing, but it was kind of take a moment, give yourself grace.
Yes. Have you thought about boards yet?
I have thought about boards.
I know.
Before I even got into nursing, nurse practitioner school. So, our school does reviews for this. So we do the Berkeley review.
Okay.
We'll actually do this coming up semester. So spring semester at the very end, we'll do a Berkeley review. And then in our final semester, we actually go to campus and spend a week there. We do some of our skills, and then we do a full review there as well. But every semester now we have done a comprehensive exam. So it goes over everything that you have learned up until that point.
I see.
Which
that's great.
When I was first starting there, a lot of people were like, oh, exams are so hard. I spent 6 months studying for exams. I have a couple of friends who went through their FNP program, and when they got out, they didn't pass their first time. And it was kind of daunting to me. I'm like, these are very smart people that I know that they know what they're doing and I'm very confident in their abilities, but they didn't pass their exam. And so I was nervous. But when I asked them, what did your program do to support you? What did your program do to prepare you for this? They didn't do anything. They didn't do any reviews. They didn't do comprehensive exams. It was kind of just you're thrown to this, this test and they tell you, oh, you're going to have to do all these things. Here are your resources that you can purchase, but they didn't do anything to prepare them. Whereas I feel like my program has done a really good job of pulling things together every semester and then ensuring that you're not forgetting any of this knowledge. Everything builds on itself, so you can't forget it. Like you have to know it to be successful for every semester.
Great that they do that.
Like I said, our program has been wonderful in preparing us. It's a very different experience from what I had for my undergrad degree, and that's not knocking them. It's just I feel like there's so many people who go through nursing school that they probably weren't thinking about that, but I can tell that this program has spent a lot of time perfecting that. So I'm glad that this is where I ended up.
Okay. Well, this was not actually intended to be like a UAB promotion.
It really wasn't, I promise.
But and I think it is a big program in our area. I know that they do prepare people pretty well, and I think it's good to hear from people who are going to schools that are in a program that can be fully online, completely asynchronous, allow you to work, and still do a good job getting you ready.
Yes.
Good sim labs, great preparation for boards, good access to your teachers, support with clinicals. These are kind of hard to find in a program that is affordable. And it's sort of hard when you're searching for schools to find something that has all of this in the right ratios, I guess is the word I want to use. So I think that she gave us a great example of how it should work, and it should work this way. And I can't wait to see where you land. It's
I know.
amazing.
So
I love
excited.
watching people start from a place of, I think I want to go back to school to then succeeding as an NP. It's really magical to watch. Yes. And you're going to be great.
Oh, well, thank you so much. Well, I'm very excited to be here. I love this little, setup that you have. So thank you so much for welcoming me. And I'm excited to be here.
Yeah. Okay. All right, everybody. Have a good week, and I'll see you next time.
Thank you so much.